You know, and we would be remiss if we didn't bring up an instance of maternal mortality that has been really in the spotlight right now, and that is the death of Tori Bowie, right, the Olympian who recently passed away. And so we actually have an audience question from about this issue. Mignon Clybourne, and if I have mispronounced your name, I am sorry. I believe in putting respect on people's names, so I apologize up front.
Right.
The death of Tori Bowie is yet another illustration of the gross disparities in African-American maternal health. Please share how the profession plans to heal itself when it comes to these tragic outcomes. This should be unacceptable in 2023. Do you agree? And what does the death of Tori Bowie highlight with this crisis for you?
Yeah. So of course I agree that it's past time to do something, right? Dr. Hernandez and I were talking earlier that there have been decades of just constant research about the current state of maternal health care and that Black women suffer from these inequities, right? And so now it's time to do something. And so what I often think about as a mother of a 13-year-old, hi Kennedy, I had to do it.
Yeah.
But also as a clinician, right, because I care for pregnant and postpartum people and then their children afterwards, is that people do not want to go in the hospital. They do not. They feel like if I go there, something bad is going to happen. People aren't going to hear me. They aren't going to see me. They aren't going to care for me. So how do we restructure those systems to better serve and care for the people that they're supposed to? But, and I say this every time in every space that I occupy, is that Black women, especially Black midwives, not necessarily nurse midwives, they are also amazing, but Black certified midwives do the work and have great outcomes. And the healthcare system, the medical system should learn from midwives and see what that care looks like and why people are choosing to give birth at home instead of in the hospital, because they're deathly afraid of something, you know, going wrong and being mistreated and not leaving the hospital to live to raise their child.